Hi, Mzansi. You are listening to Farmers Inside Track, proudly brought to you by Food for Mzansi. I am your host, Patricia Timbo, and welcome to episode 519. Today, we're looking at a very important topic, and that is foot and mouth disease. Although foot and mouth disease is a controlled and notifiable disease, it does remain a persistent challenge in South Africa's livestock sector, as most of us know. This episode promises to be both informative and practical as we welcome Prof Ishmael Jaja, who is a veterinary expert and researcher at the University of Fort Hare. Prof Jaja will unpack the complexities of controlling foot and mouth disease and also share management strategies to help you keep your farm free of the disease. Prof Ishmael Jaja, welcome to Food for Mzansi's podcast, Farmers Inside Track. We are very pleased to have you on today's episode. To our listeners, Prof Jaja is a veterinary surgeon, researcher, and lecturer at the University of Fort Hare. But Prof Jaja, for our listeners who have not heard of you, maybe you could share a little bit more about your work in the animal health and agricultural industry and just more about who you are and your work in the space.
Thank you, Patricia. As you mentioned, my name is Ishmael Jaja. I am an associate professor at the University of Fort Hare. Specifically, I work in the Department of Animal and Pasture Sciences. I am a veterinarian by training, and I teach infectious and non-infectious diseases. I also teach elementary animal health as well as anatomy and physiology. I teach these modules to animal science students at the University of Fort Hare. My research is in animal health. I have interest in foodborne diseases, whatever infection that affects the food that humans will consume in the end. I have interest in those, so my research is mainly in that domain, whether it's food microbiology, food protozoology, and little of viral infections.
Thank you so much for sharing more about who you are and the work you do. I'm sure your students would be keen to hear you on the podcast as well. But looking at today's topic, it's in the headlines currently at the time of recording this video, and that is foot and mouth disease affecting cattle. So we are going to be exploring a little bit more about the disease and the biosecurity management farmers can apply. And to set the context, Prof Jaja, could you maybe just give an explanation of what foot and mouth disease is and how it affects whose animals, such as cattle? I understand that it's not a zoonotic disease, but you can correct me if I'm wrong about that. But maybe just give us just an understanding of what the disease is.
Foot and mouth disease is mainly an infection, a viral infection in cloven-hoofed animals. What we mean by cloven hoof, we mean animals that walk on two toes. They're two-toed. That's cloven-hoofed animals. Mainly this infection, when it occurs, it causes vesicles, excessive salivation, lethargy, weight loss, etc. in these animals. Of course, when we say it causes vesicles, we mean that these vesicles will be found around the foot, the hoof, and the mouth. So this is what we call foot and mouth disease. And just to be specific, this virus is called aptovirus. It belongs to the family Picornaviridae. And if I were to further describe this virus, it's got different types within that family, 7 distinct serotypes, and they occur in different ways. There is also what we call cross-protective issues around this virus. So the virus is not cross-protective. So if one type of the serotype infects an animal, it does not convey immunity to the next one who will be infected with another serotype.
Maybe if you could just expand on that, please, the last point you made.
So this virus has 7 distinct serotypes. By serotype, we mean different types that can infect an animal at any given time. And we say that, for example, if type A were to infect the animals in a farm, the next farm, which type C, there will be no protection because type A can still infect in that community because it has not occurred there before. So there will be no cross-protective effect between one species, one serotype, and another.
Can one say that a serotype is the same thing as a strain, that they're different strains of this disease?
Correct.
So looking at the current outbreak in South Africa, if I'm not mistaken, it's 3 strains. Is that what contributes to the contagiousness of this disease? Maybe explain the current outbreak, how strains play into that.
So strains complicate the control effort. Remember, there are traditional ways of controlling FMD, which in the South African context has completely failed. Test, slaughter, preemptive slaughter, control of movements, and all of those epidemiological surveillance tools. But when you have multiple strains, which we have said do not cross-protect each other, it complicates control efforts.
I assume that is why the vaccine is not as accessible because of the different strains. We know that the Department of Agriculture has ordered doses of the vaccine to be administered in the prioritized areas. But why is the vaccine highly controlled? Why is it not accessible for farmers to use?
First of all, FMD is a reportable disease. You can also say it's a controlled disease. The use of those words are just semantics. It is a government-controlled disease because of the severity and economic implication. Issues around FMD cannot be thrown open to the public. It has to be dealt by experts. And that's one. Vaccines in generally are also controlled tools because it's like having many tools in your bag. And sometimes vaccines are some of the bottom line of control for many diseases. You just don't throw it open to everyone. So FMD being a controlled disease and the vaccine being a very sensitive vaccine has to be very limited. And in many instances, the decision to use a particular vaccine in a particular location, in this case, South Africa, has to be governed by science. And that science has to be proven to be efficient. Before a country makes a decision, it wants to use vaccine. It would have put experts together to make that decision. So that decision, South Africa perhaps would have arrived at prior to saying we want to now deploy this last tool, vaccination. So this is one of the reasons why the vaccine is very scarce. It is not your regular vaccine, so it has to be that way.
Questions are going around farmers and just stakeholders with a lack of knowledge and exactly what foot and mouth disease the vaccine entails. There's just a lot of talk on this saying that they're questioning as to why not just vaccinate. What is preventing government from simply vaccinating or making it accessible? But now you've explained that quite clearly. Looking at biosecurity, why is it important? What role does biosecurity play in preventing the spread of this disease?
For us to even begin to talk about biosecurity, we need to know what biosecurity is. And I work in a university that is in a rural area, and we deal with communal farmers every day. So because Food Mzansi will be publicizing this, it's also very nice to talk about biosecurity. But biosecurity is a complex term, but we'll take the basics. Every measure or practice that you put in place to guard against the introduction and spread of a harmful disease agent, or in fact, any biological agent aimed to protect whether it's humans or animal, and even the environment in some cases, it's a biosecurity step that you have put in place. And to answer the question, why is it important? Like they say, prevention is better than cure. And that's very apt at this point because biosecurity is a tool to prevent. If you can prevent, you will not cry later.
Prevention is better than cure. And I think that is just the underlying theme for this podcast, discussing foot and mouth disease. So looking at practices that farmers can implement to prevent foot and mouth disease, what are they? What are the main control measures farmers can take? Maybe speaking more to those in the communal areas as well.
I would be very honest. Biosecurity implementation in communal setting is very, very difficult to achieve. It is a tall order. But there are certain things within the biosecurity pool that we can advise communal farmers to try to adapt. They can adapt it in the full shape of it. They can adapt it partially, depending on what is available to them. The first one is that if a communal farmer approaches another farmer in the next village seeking to procure his animals, he needs to separate that animal from the ones that he already has. And that's what we call quarantine. He needs to have an area demarcated with whatever local material available to keep those animals for at least a minimum of 2 weeks to observe. And I think from 10 days to 14 days, that's sufficient for the farmer to be able to see if the animal is healthy or came with certain diseases. That's one. Restricting such animals from movement would help you avoid the spread of infection in times of outbreak. The other thing is for farmers to increase their ability to observe animals. The act of observation, physical observation of animals, is very important because by merely standing from a distance to observe a head of an animal every day, you can spot the difference. Thick animals oftentimes are not the ones usually with the pack or with the head. You would most likely find them struggling to move, struggling to eat, and even drink water. And you'll find them sometimes listless and confused. I know the word confusion is commonly used in humans, but it happens in animals as well. So that act of physical examination is very important that communal farmers practice. Just in general, because we touched on the issue of vaccines, because farmers won't be allowed to handle FMD vaccines. But for all other diseases, vaccination can prevent. So vaccination to prevent becomes very important, where the farmer, in the case of FMD, can consult his local veterinarian to request that he or she be assisted with vaccinating to protect the herd. We're still talking about FMD, hygiene. Hygiene is very important, and sanitation. Disinfecting the tools that are used in the farm to administer medication to animals, tools such as dehorning blades, syringes, castration instruments, etc. All these tools that are often used for animal examination should be disinfected, including the handlers of these animals must wear protective clothing, wear also protective gears that will protect the animals. They must also practice hygiene so that they are not a source of infection to the animals. Is it possible that communal farmers can practice differentiated farming or livestock keeping? What I mean by that, can they have a separate area for cattle while the pigs are very far from the cattle and the sheep and goats are not together with the cattle? This is also very important. So separating species in livestock farming in the communal area is very important. And why is this so? If I had enough time, I was going to touch on the issue of disease hosts. And in the case of FMD, we have what we call amplifier hosts. We have what we call maintenance hosts. We have what we call the indicator host. And these are different species of animals. Separating them and farming them apart is also very useful in trying to prevent these kinds of infection like FMD.
That's quite interesting. Looking at this last point that you made in separating species, do you think that has played a role in the spread, that outbreak we're seeing now, that it's probably spreading, like as you mentioned, from the sheep to goats to the cattle? Because I don't know how common that knowledge is to separate livestock within the production process. So I think that's an interesting point you mentioned.
It is. I have to say that it is one of the main drivers of the reoccurring infection in different parts of the country. And because when you look at the sheep and goats, it's a maintenance host of FMD, for example. And what is a maintenance host? A maintenance host is just an organism that harbors and sustains a pathogen over a period. In fact, I can say over a long period, and does potentially become a reservoir for that infection. And in this case, FMD. So sheep and goat is a reservoir for FMD. You can chase this disease in cattle and you forget that the goats are reservoirs, goat and sheep. And then the next one is the amplifier host. And the pigs are amplifier hosts. And what is an amplifier host? Is where the pathogen multiplies rapidly, leading to high concentration and increased transmission potential. And then the cattle becomes what we call the indicator host, where the disease finally shows, which is why cattle is the hotbed of the disease.
I'm wondering if that is something that is largely overlooked in trying to curb the outbreaks that we're seeing right now. This is just not something that I've come across, I've been reading. The focus is mainly on cattle. Is it possible to identify or to determine the presence of this disease in the other hosts that you've mentioned?
Oh, yes. Actually, the disease has very similar clinical signs, and they share so much similarity in all. The signs in the sheep and goat is very mild. This is why it's not been talked about. But even at that, the sheep and goat is a maintenance host. In the pig, the clinical signs are always there. There is those vesicles, those oral lesions in the snout. The mouth of the pig is called the snout. So those lesions are there in the snout. They are there on foot and you still have them. But the cattle tends to be the one with the most severe clinical signs. This is why the cattle becomes the center of attention.
And then you mentioned quarantining animals as an important control measure, and you mentioned 2 weeks. Is that the incubation period of this disease? I think we haven't spoken yet about the life cycle of the disease. Maybe if you can just expand a little bit on that, on how long it takes before symptoms show and within the animal.
The 10 to 14 days that I mentioned is the routine number of days that quarantine is usually done in livestock. The incubation period also happens to fall within this period. Mm-hmm. However, you should note that the incubation period for this virus is 2 to 14 days. That's the specific incubation period. But for quarantine in general, we recommend 2 weeks.
So within this time frame, a farmer would then be able to identify symptoms or signs of the presence of foot and mouth disease. That makes sense. And another control measure you spoke about is observation and just how important that is. I know of the 5-point check, checking the health or the wealth of livestock. Maybe if you can expand a little bit more on what signs specifically to look out for in cattle when it comes to foot and mouth disease.
Fortunately, with foot and mouth disease, it's one of those diseases where the clinical signs are very obvious for the farmer to recognize. When I teach students, I tell them when they give me one of the clinical signs as fever, I always mark it wrong. I just say, don't give me fever as a clinical sign, but it is a clinical sign. But you cannot see fever with the eyes. But let's talk about the things that farmers can visualize. One of them is vesicles. A vesicle is a swelling on any part of the body, usually containing fluid. And after some time, that vesicle will rupture and then forms scabs, drying and sloughing off. So here you find vesicles, for example, in the cattle. You find these vesicles on the feet, the mouth, the nose, the muzzle, and the teeth. The teeth, we mean the mammary gland, the teeth of the mammae, the breast, if it's a female animal. These vesicles would then progress to what we medically call erosion. Erosion means it will break open and then starts falling apart. That's what we call in medicine erosion. There will be lameness. Remember, when the feet of an animal has these injuries, they will be unable to walk. They struggle to walk because they're feeling pain. So because of these animals will be reluctant to move, their hoof will be sloughing away. In female animals, there will be abortion. This disease can lead to the death of young animals. I emphasize young animals. So when this infection is described in the oral cavity, you find the same description of sloughing on the tongue, dental part, the gums, around the mouth. Because of the nature of the broken part of the mouth, the sloughing off of the inner part of the mouth, the animals will be salivating. So we call that excess salivation. There will be drooling of saliva and there will be nasal discharge. And usually in animals, when there are issues around the teeth, the tongue, the gum, the upper palate, the lower palate, that animal will be in great discomfort and pain and will most likely not be grazing. Cattle, for example, graze on grasses. Grasses are hard. They will further complicate the pain in the mouth. So what will happen over time? The animal will become lethargic, meaning they will lose their body condition. They will become very lean and thin. They lose weight because they are not eating. For female dairy animals, for example, the lesions on the teeth, which is the breast, will lead to decreased milk production. For the feet, the commonest places to find these broken skin or sloughing off is the interdigital space. We mean in between the two toes. The coronary band, just immediate after the digit, you find the coronary band. And of course, I've described that there will be lameness in such animals and reluctance to move. What you see here in the cattle, you would most likely find in the pigs, but less in sheep and goat.
So with these clinical signs, do they all have to be present at once? Because I know, for example, abortion is a symptom of brucellosis, or the lesions on the teeth could be mastitis. So how can a farmer identify these symptoms and attribute them specifically to foot and mouth disease?
Foot and mouth disease main description is vesicle formation. There cannot be abortion without vesicle formation. The both will happen at the same time. That's how you know that it's not an abortion from brucellosis, listeriosis, or any other campylobacteriosis. Can I also add at this point that, yes, a farmer needs to report because there are other diseases that causes vesicles. Vesicular stomatitis. In the pig, there's swine vesicular disease. Again, in the pig, there is vesicular exanthema. So for pig farmers, they really need to report so that the laboratory can really point precisely to which virus is infecting the animal.
Now that you've mentioned reporting, that is of course important because it is a controlled disease, as you've mentioned. Is it as soon as they identify these clinical symptoms in the herd, or is it when they suspect, I suppose, neighboring farmers as well? How would a farmer report? When is it the best time to report an incident of or suspected foot and mouth disease on the farm?
It's when the clinical signs are found. The issues with finding this in the neighboring farm and reporting, that's also a way to report because you are preempting the disease from getting to your farm. It's important that you call the attention of the authorities to find out what's happening in your neighborhood. So it's good neighborhood watch because it helps prevent or potentially reduce the impact of diseases, not just FMD.
Are there consequences for not reporting foot and mouth disease on a farm?
Oh, yes, there are. Farmers, veterinarians, animal health technicians bear the responsibility to report diseases. In South Africa, failing to report foot and mouth disease when it is suspected or diagnosed is a violation of the Animal Disease Act of 1984, especially the section number 35. And of course, this act mandates any suspicious clinical symptoms of FMD, whether it's salivation, as we have described it just a while ago, that you report to the government, to your veterinarian, which is the closest person to you, or to your agriculture office, which is nearest to you.
I think that is quite clear. Maybe to close off the discussion, what role do vets and, as you mentioned, animal health technicians play in curbing foot-and-mouth disease? What supports is available for farmers when it comes to preventing foot-and-mouth disease?
Vets and animal health technicians are at the core of primary animal health in the society, in the community. And usually in many provinces, they are strategically located close to where farming communities are to provide that service. I do know the issues of inadequacy of vets in the country. However, they provide care for both healthy and sick animals. In the case of healthy animals, veterinarians and animal health technicians are in charge of heart health programs in various farms, maintaining the heart health programs in various farms, including preemptive vaccination to protect animals, application of preventive therapies, what we call chemotherapies, to prevent the occurrence of diseases. And in the case of FMD, it is very complex because it's a viral infection. But for every other treatment, the vets are there to help farmers keep the animals healthy and to achieve the purpose of keeping them on the farm, which is food security. And farmers can find them in various municipalities. Not all municipalities have vets, but all municipalities have agric offices with animal health technicians in those places.
Prof Jaja, if there's anything that you would like to discuss that you'd like the farmers to know regarding foot-and-mouth disease that we didn't touch on in this conversation, you can expand on that if there's anything that you would like to add to this episode.
I would just want to talk a bit more on the biosecurity and prevention. Education is very important, especially in this day and time. Farmers should pay attention to educating themselves, especially now when there is smart devices, smartphones, tablets. Read about FMD, know a bit about them so that your mind is conscientized on what to expect. Get to see the images of what it looks like so that even if it's not in your farm and you go to buy animals somewhere, what you've read and the pictures you saw would help you immediately make a good decision. That's very important. So education and training of farmers, very important for government to do. FMD is transmitted via respiratory aerosol. These aerosols travel long distances. And with a proper temperature and humidity, meaning certain seasons of the year, it can travel and be alive for a very long time. The virus can survive in a pH lower than 6.5 and in a pH above 11, meaning it's a very resilient virus which can stay alive for a very long time. What does this mean? Farmers must try to make sure that anyone visiting the farm must wash their hands in certain solution, disinfectants. Wash their hands, dip their foot. The car tires must be sprayed to avoid the transportation of these pathogens from somewhere to your farm. Farm workers must be alert themselves and must not be casual about biosecurity because even the disease can be transmitted via direct contact from one infected space to another infected animal. And I also want to say that FMD is a serious infection. In South Africa, it poses a lot of problem. And now that traditional control measures have failed, the country is spending over 70 million to import vaccines, which is a burden on the country's fiscus. Vaccine, in my view, is a last line of control measure. And as a veterinarian, if it fails, we don't have a second option because it is the last line of control measures. Because of the outbreak of FMD, meat exportation in South Africa is limited. Several countries have restricted the importation of South African meat and meat products because of the issue of FMD. So when we look at the implication, whether it's economic and trade, very important. It has really limited South Africa's ability to export its livestock. You must know that in Southern Africa, South Africa exports meats most of the countries. In Europe and in Asia, including China. So it's a big exporter of animals and animal products. With the outbreak of FMD, countries will be weary to receive livestock products from South Africa. In a nutshell, my assessment will be that FMD is expanding and is even reaching provinces that previously never had it, including the Eastern Cape. The traditional provinces, which used to be Gauteng, Limpopo, KwaZulu-Natal, which is the leading one, we now have newer provinces experiencing FMD. And this points to a growing problem. I've mentioned the issue of the traditional method of control failing. The economic consequences have also touched on it and how it is disrupting the supply chain in terms of meat, beef, and its products. In 2025, there is still reports of new outbreaks. And what does this tell you? It tells you of a sustained transmission of the disease and new infections happening in new places. What about the regional significance of this? South Africa as a leader and key agricultural producer, its position in terms of livestock product and export is compromised.
Thank you so much to Professor Ishmael Jaja, who is a veterinary expert and researcher at the University of Fort Hare. You can read more about this conversation and this topic by visiting www.foodforumzansi.co.za. And that brings us to the end of this episode. Remember to subscribe to our podcast on your favorite platform. From me, Patricia Tembo, our technical producer, Megan van der Vent, and the rest of #Team Food Forum Zanzi, thank you for listening.